This is a demo for lung ultrasound by Chison SonoEye. When the coronavirus attacks the lungs, the human body will have symptoms such as cough, cold, or headache. As the disease progresses, lung lesions like bronchitis, pleural effusion, pneumothorax, and pulmonary edema will happen, which would cause respiratory syndrome, renal failure. Lung ultrasound can be useful in pleural pathology, pericardial pathology. Then, the SonoEye can bring you a new resolution in pocket. All of the types of SonoEye can support the lung preset. The pleural or visceral and parietal layer glides with respiratory movement to form lung sliding. Pneumothorax can be excluded by pleural sliding sign. In normal lung, horizontal lines arising at regular intervals from the pleural line can be seen, which are called A lines. B lines are defined as discrete laser-like vertical hyperechoic artifacts that arise from the pleural line and extend to the bottom of the screen without fading. It always moves with lung sliding. Same as A-point profile, the B-point profile is a B profile with abolished lung sliding. The AB profile is a half profile at one lung, a half B profile at another. Lastly, we can refer to the decision tree of the Blue Protocol. In order to improve the sensitivity, multiple coastal spaces should be scanned on each side of the chest. Now, let's take a lung scanning. P5 is used in the exam. Before scanning, we sterilize the probe and the machine. Connect the machine with the phone. Switch on the SonoEye. Firstly, find the blue dots when supine position. Usually, we scan around the upper blue dot and the lower blue dot to check if there is pneumothorax. Secondly, find the diaphragm dot at the cross of the diaphragmatic line and the maxillary line. Thirdly, find the plep's dot at the cross of the lower blue dot extension line and the posterior axillary line. To improve user experience, more dedicated lung softwares and the comparison report are included. Besides, the hardware such as waterproof multitask are allowed for SonoEye. For more information, just refer the tutorial in the menu. Thank you.